Hello, Miss Ivy Jackson. My name is Kiera Gallo. I'm the nurse practitioner. You can call me Nurse Gallo. Thanks for making a visit with us today. Can you please give me your full name and date of birth?
Ivy Jackson, 10/24/1963.
Perfect. Are you taking any medications and do you have any allergies?
I'm taking lisinopril and hydrochlorothiazide and no allergies.
Perfect. Can you please tell me the date and why are you here today?
My mind always feels foggy. It is November 20th of 2025 and I am at the doctor's office for a checkup.
Okay. Are you having any pain on a scale from 0 to 10? 0 being no pain, 10 being the most pain you probably ever had.
0, no pain.
Okay. So what's going on today?
I have lost 10 pounds recently. I have poor appetite. I'm always tired, even as we speak. My husband asked for a divorce a couple months ago due to my lack of interest in doing things. He left 3 weeks ago. I have been so lonely, constantly crying and shaking. I feel like life is over sometimes. I want to get a counselor recently. She sent me to a psychiatrist to prescribe me vanilla vaccine. I felt better, so I stopped taking the medication and I'm here today.
Okay. So feeling unmotivated, uninterested. If you don't mind, what I want to do is go ahead and in a second I would like to conduct your head-to-toe assessment. This will conclude like physical and emotional. So I have a few things that I want to ask you. You think that'll be okay with you?
That's okay.
All right. If you don't mind, I'm gonna go ahead and get your vitals real quick.
Okay.
Alright, so first I'm going to put this on this finger over here. This will check your SpO2. And on this one, I'm going to check your blood pressure, okay? If you'll try to just sit as still as possible for me. Alright. So that blood pressure is slightly elevated, 138/86. I did notice that you are on the lisinopril HCTZ, so we're not too concerned about that. Your SpO2 is at 98. That heart rate is at 76. No concerns there. Next, I'm gonna just go ahead and do that head-to-toe assessment. I'll explain everything for you. I started your head all the way down to your feet, and I'll explain everything just as we go. If you don't mind, I want to ask you a question before we start though.
Okay.
How's your mood been on a scale from 0 to 10? 0 being completely sad and uninterested in things, and 10 being the happiest you have ever been.
I'll say a 3. I'm always bored, unmotivated, and uninterested in participating in any activity.
Okay. So what I'm going to get you to do is go ahead and fill out this PHQ-9. This is an assessment that'll help me gauge how your mood is. It's geared a little bit more towards depression. And also there's a Columbia suicide screener on the bottom. And this will help me determine if you're having any suicidal ideation, okay? And I'll explain it more after we're done. I'll tally that up for you. Have you ever considered hurting yourself in any way?
Despite what I have gone through in life, I can't end my life. I know still too much to enjoy. However, I appreciate your concern and thank you for that. My support system is within the church.
Okay. Thank you for letting me know about your support system. I do notice that your score is at 18 on this PHQ-9. That's just showing me that it's affecting your day-to-day life. Of course, that's not your normal. That's probably why you're uninterested and unmotivated. I noticed that you don't have any suicidal ideation, so we're not concerned there. Where the physicians want you at on that PHQ-9 is a 4 or below. Okay, so we'll work on getting you there, and I'll explain a little bit more after this head-to-toe assessment. Okay. Thank you for filling that out.
Of course.
All right. First, I'm going to start with your head.
Mhm.
I already washed my hands. Let me grab my gloves. Okay.
Okay.
Alright, and we'll discuss medication about that depression side of things whenever we're done, if you're okay with that, okay?
Okay.
I'm gonna start with your head first. I'm gonna assess your head. Make sure there's no lumps, bumps, bruises, and no infestation, okay?
Okay.
Perfect. No lumps, bumps, bruises. I don't see any infestation. Next, I'm gonna use my pen light. Can you remove your glasses for me, please? I'm gonna use my pen light. I'm gonna shine the light in your eyes just to make sure that it's reacting, okay?
Okay.
I'm gonna start on this side. Perfect, it's reacting. Nice, those eyes are pearl of equal, round, and reactive to light. Can you please open up your mouth for me, Miss Jackson? Thank you. I see that those mucous membranes are dry. You probably need to go ahead and intake some more fluids to prevent your mucous membranes from being dry, okay? No drainage or anything in your nose?
No, ma'am.
Ears?
No.
Perfect, okay. If you don't mind, I'm gonna take a look at your ears. Onto it. Up and back, no problem. I'm gonna switch this over to this side. Up and back, no problem. Oh, I'm sorry. I messed up your hair, ma'am. Alright. Next, what I wanna do is listen to your heart and your lungs.
Okay.
Every time I put my stethoscope down, if you don't mind, I'm gonna ask you to take a deep breath, okay?
Okay.
Perfect. Could you sit up a little bit for me? I noticed that you're slumped. If you're feeling tired in between, just let me know and I'll stop, okay?
Okay.
I'm gonna move your hair so I can listen back here. Take a deep breath every time I put my stethoscope down. Those lungs are clear in all lobes to auscultation. Next, I'm gonna listen to your heart, okay?
Okay.
Perfect. This one I'm gonna listen a little bit longer, okay? So I can determine your heart rate. I got 76. That is normal rate rhythm. S1 and S2 heard, okay?
Okay.
Can you please lay back for me so I can assess your stomach? I'm gonna listen first and I'll feel. When was your last bowel movement?
Like 4 days ago.
Okay. That might be okay. Seeming as though you're having a low appetite, okay? I'm gonna listen first in all 4 quadrants, just to make sure that we're having some bowel sounds. All right. Perfect. Okay, now I'm going to just go ahead and palpate just a little bit. If you feel anything tender or anything hurt, let me know and I'll stop, okay? Does this hurt?
No.
Does this hurt?
No.
Okay. Does this hurt?
No.
Does this hurt? Okay. And bowel sounds are active in all 4 quadrants. I'm gonna help you up. Perfect. Next, I'm gonna inspect your extremities, okay? If you don't mind, and your skin turgor and everything else. I'll also check your capillary refills just to make sure. Perfect. Less than 1. 1. Perfect. And all. Let me make sure that your skin isn't tinting. I'm noticing a little bit of tinting. This just means that you're dehydrated, so you need to go ahead and like I said, intake of some more fluids, okay?
Okay.
Perfect. That skin is, your skin is clear and intact, normal for ethnicity. I'm gonna go ahead and check these pulses, okay, if you don't mind.
Okay.
Equal rate and rhythm, no problem there. I'm gonna check your feet now if you don't mind, okay?
Okay.
Have you noticed any swelling or anything?
No.
Okay, I'm gonna check your pulses down here as well, okay?
Okay.
They're equal. 1+, and I'm gonna check your capillary fills down here. Ah, everything looks good down there. All right. I want to discuss a few things if you don't mind. Your assessment came out fine. As I said, you're a little bit dehydrated, so if you can, please just go ahead and intake some more fluids. Try to drink as much as you can, especially if you can't eat. Just make sure that you're drinking, okay?
Okay.
So, Miss Jackson, I know your chief complaint is you've been fatigued, uninterested, unmotivated. You lost 10 pounds because of your poor appetite. We did the PHQ-9, and it did show that your PHQ-9 did show that you had an 18 score. Like I said, the physicians want you at a 4 or below. This just showing that it's affecting your day-to-day life. If you don't mind, how about we try some escitalopram? We'll start there. It's a serotonin reuptake inhibitor. So basically, your brain is lacking serotonin. This medication will basically balance out those neurotransmitters in your head and help you feel a little bit better. This medication does take about 4 to 6 weeks to get into your system, so if you would please do not stop the medication abruptly. Continue to take it. If you feel like you're feeling better, give us a call and let us know, and we can try to taper you off safely, okay? Because we don't want you to have any, as you said, you stopped taking the venlafaxine and because you were feeling better, but then you're here again. Those medications can cause withdrawal and make symptoms even worse, okay? So considering those low levels of serotonin, I think a 10 milligram of the escitalopram will be beneficial for you, okay? Would that be okay?
Yes.
Okay. I definitely want you to follow up with me in 6 weeks.
Okay.
I do want you to see a licensed clinical psychologist. I'll put in the referral for you. I know you have your support through the church, but I feel as if you had that extra support, he might have some tools that can help you. I know a very good clinical psychologist. Do you have any questions? Can I clarify anything for you?
No.
All right. Thank you so much, Miss Jackson. I'll see you soon, okay?
Thank you.